June, by the way, is Men's Health Month. Can I just pause a second and say about time we got around to our month? We got to talk about the dudes for half a second here tonight. In our edition of Eye on Your Health, we are joined by Dr. Jeremy Brown. He's family medicine with Baylor Scott White. We want to talk about men's health in general. So first of all, welcome in. Thank you for being here.
Thank you so much.
So we talk about dudes and problems. What do you put at the top of the list of concern if we want to be consistent about looking for it, like proactively looking for anything?
So first off, thank you so much for having me.
Oh, you bet.
To be here. One thing that we really need to focus on with men's health is prostate cancer.
Okay.
That's a big thing that with my male patients, once we hit a certain age, that's a very high topic on the list.
And I have friends who aren't of, I think the age is in the neighborhood of 50, right? Where you definitely want to get checked after that. But I have friends who, because of family history, they're getting checked at 25, 30, 35 years of it. So that's not abnormal if you've got a history, right?
Well, actually, it's recommended. So 50 is kind of our consensus age to start screening.
That's like all guys need to start doing it.
Yes, sir.
Okay.
But when we look at things like family history or being African American, actually, so those two things, we should start screening at 40, actually.
Okay, so 40 becomes a number. So talk to me about that you bring up with African American and maybe any other race or ethnic background. Are certain races or ethnic backgrounds more prone than others? And what do we know about the why, if any?
Absolutely. So with African American men, there is a 76% higher prostate cancer risk compared to Caucasian men. And Asian men actually are at the bottom of that list. So we just kind of touched on the appropriate ages to look at for screening. But as far as what might be the cause for that, so being an African American male myself, there are definitely some genetic predispositions there.
So there are predispositions in the race.
Yes, sir.
And what about, I think through the decades, I mean, if you read anything health related, socioeconomic comes into play as well for African American males.
Yes, sir. And I'll say, unfortunately, I found this very interesting. A lot of African American males, what happens is they don't go to the doctor. Right. They wait too long, and the next thing we know, they go to the doctor because they have an issue. We realize that they have a higher stage of cancer.
It's been festering a longer time.
Yes, sir.
Because they didn't go early enough and be proactive.
Yes, sir. So prevention is key, and early detection actually saves lives.
Yeah, and early detection. So say it out loud for anybody watching and listening. Guys, even if you feel great,
yes,
you should get checked. And for prostate cancer, you can have the standard that people are used to, but there's also the PSA test.
Yes, sir.
Right? Are we feeling okay about either one or the other? The PSA is a blood test.
Yes, sir. So that stands for prostate-specific antigen. And historically, there is we call it the digital rectal exam was the way we would screen.
The uncomfortable one.
Yes, that makes men run away from
100%.
From seeing me.
Yeah.
So the PSA is a less invasive test, and it's a blood test that we use to help kind of guide and gauge over years to help us determine prostate cancer risk.
And with the blood test, last question, if something is there or is present, you will see it in the blood markers?
Yes, sir.
And you'll see something that alerts you, right?
Yes, sir. So an elevated PSA doesn't always mean that you have prostate cancer. However, we use that number to help guide us. Okay. So that number helps us determine, is there further testing that we need to do?
There you go. It's your knock at the door. Hey, Doc, we need to look at this a little further.
Absolutely.
All right.
Absolutely.
Some great stuff tonight. And, at the end of the day, guys need to be proactive.
Absolutely.
And we talked before we got on the air, I think guys in a general sense are beginning to get more proactive. Hopefully the next generation is coming up. Dr. Jeremy Brown, Baylor Scott White, thank you for being here tonight.
Thank you so much.
It's good, solid advice.